Here is our host, Tian Wei.
Hello and welcome to World Insight. I'm Tian Wei in Beijing. Bloomberg's latest COVID resilience ranking has raised eyebrows around the world. The U.S., with over 10,000 new confirmed cases daily, was rated as the best performer, while China ended up 8th in the ranking. The Chinese Foreign Ministry on Monday questioned that ranking's credibility, saying it fell way short of respecting facts, science, and lives. Meanwhile, in the Pew Research ranking released in June, China scored higher marks for handling the pandemic than the U.S. did. These results were based on data gathered from surveys in 12 countries, while for Bloomberg's ranking, indicators such as infections are not included. Lockdowns and border control have been used as negative indicators. Of course, these are just the numbers given out by research data and also by news agencies. Whether they're accurate or not, that's another question. But certainly, the debate about who is doing a better job has been with us for a long time. Let's loop in our panelists for their thoughts. For more discussion, joining us from Washington, D.C., Dr. Kate Tulenko, CEO of Corvus Health, a global health advisory firm in New York, Jeff Schlegelmelk, Director of the National Center for Disaster Preparedness of the Earth Institute at Columbia University in Beijing, Hai Fang, Professor in China Center for Health Development Studies from Peking University, last but not least in Nanjing, Wu Zhiwei, Director for the Center of Public Health Research, Medical School of Nanjing University. Ladies and gentlemen, welcome to the program. Is it too early, Professor Wu, to say who is doing a good job as we are seeing Delta variants become the biggest concern for the world now, and we still do not know how much vaccines could work?
A couple of issues we have to be very clear that the current vaccine basically provide the protections against hospitalization and severe diseases, and also preventing the death caused by COVID-19. It doesn't really based on the preventing the new infections. So we have to be extremely cautious that when the pandemic is still going on around the world, that all the proper public health approach should still be implemented before we do see a clear sign that the disease is going down. So this is something actually everybody has to bear in mind.
Too early to celebrate, Dr. Tulenko?
Yes, it definitely is. It's very concerning that with very large epidemics of the COVID virus in Indonesia, India, and elsewhere, we'll probably see more variants of the virus that are even more infectious and perhaps even more deadly. So that is a concern. And as far as who the current winners might be, in my opinion, the current winner is Chile. You have a middle-income country that's managed to vaccinate over 70% of its population.
There are several so-called standards that are being used by one survey or another about how to measure who is the so-called the current successor. But that's, to me, a little bit interesting. I don't know how scientific that is. Meanwhile, how much is agreed upon by the international community. Without really going into details, because it's really not that meaningful, let me have more expert views from all of you. Jeff, tell me more about how you think about the current uncertainty we're still facing and the realities we need to face.
There's still a lot of unknowns. There's vaccines out there, but I think the other word that I would use to describe what's going on is unevenness. It's very uneven. We have some cohorts of populations in some countries that are very vaccinated. We have others that are both vaccinated and have strong adherence to social distancing measures. And then other areas are opening up and have lower vaccination rates, and we're seeing outbreaks around the world. And so that is the phase we're in now, a lot of unevenness. And with that unevenness comes uncertainty.
Professor Fang, also about that to you, how do you see the current situation?
Collaborate together, all the world, all the countries, and we have to make sure that we have the same standard for the prevention and control, and also we have to provide vaccines to those countries without resources, particularly for those kind of developing countries and also low and middle income countries. A lot of countries with a lot of production for the vaccines, but the manufacturer may not be able to export those kind of vaccine to some other countries. So this is the biggest issue actually facing the world.
And also with the Delta variant, it seems that those countries that already have quite some vaccination also need extra shots for their population, usually the third shot. So what kind of situation overall are we facing, Professor Wu, even on the issue of vaccination?
For the Delta variant, we do know that its transmission actually is a high efficiency. Basically means that it's actually going through individuals a lot faster and more effective than the older ones. We don't really know right now whether it's more pathogenic, but this is something actually we have to leave to the medical professionals to determine to see how this variant would cause diseases. The issue is that the vaccine so far, we do have some evidence that it is still effective against the Delta variant, but how effective it's still a question.
Yeah,
so
we don't have
why,
those numbers at this moment at all. We still have to wait.
Right.
It is already a reality that science is at least a few steps behind the reality, because that's the nature of it, isn't it, Dr. Tulenko?
Yes, it's moving very fast. And you had mentioned the Bloomberg resilience score, and they recently made a change to it. And the U.S. actually is now above New Zealand, which had a very small outbreak. When I look at their criteria, it's really skewed towards countries that relied on vaccines as part of their control. So that's really going to skew it towards high-income countries that didn't do early lockdowns. And so I don't see that as a very good measure. I mean, look at the U.S., despite the fact that the U.S. basically paid for two of the main vaccines, we've only vaccinated 55% of our adults. Canada, China, Israel, Malta, UK have vaccinated more folks than the U.S. And we've just seen the lead vaccine expert in the state of Tennessee be fired because she wanted to promote August Vaccine Awareness Month. So we still have huge challenges in the U.S., and I would not put it as first in the ranks of COVID resiliency.
Let me move on to another topic that is about how to open the border, what extent to open the border, how much should we allow people, from the health authorities' perspective, people to travel freely, including those who are vaccinated or not vaccinated. Tell me more about what are some of the factors health authorities or health experts like you are looking at when you are trying to make that decision.
One of the first things I would look at is how economically dependent they are on that travel. Like, you have countries in the Caribbean who are highly dependent on tourism, and you can't go on vacation via Zoom. So you have to go there in person. So for that type of country, I probably would advise them to open their borders and be very strict about the criteria for people entering, either that they have to be vaccinated or they have to have a negative test before they leave and a negative test on arrival. You can also go the Bhutan route, which for their tourists, they charge $500 to enter the country. So it's just a different approach to tourism and a different way of raising revenues, so that if you do have an outbreak, you now have funds to help address it. So that's the economic aspect. Most countries, such as the UK, they're not really dependent on tourism, and most business visits can actually be done via video conference. It doesn't have to be done in person. Now, there are, of course, some countries that rely on huge movements of labor across the border every day.
Certainly, there are a lot of different circumstances. So, Professor Wu, your thoughts?
We have to look at the epidemiological issues and how new cases actually popping up in countries, neighboring countries. The other thing, I think it's also very important is countries' capability in responding to the new surge of the COVID-19. So this is something we have seen in China, that when we have a small cluster of infections, then local government could respond very quickly and pull down get that under control. So this is something actually the multiple factors should be put into the considerations.
Whether this approach will be sustainable. I mean, you could see the huge resources being put into the utmost attention on every, single case. So will this be sustainable? So far it is. But what about in the future?
In the long run, it's going to be a tremendous resources and economic pain. But this is something actually I think we have to do it in the short term to put down the virus, and then the economic activities could come back to normal.
For the case of China, in Wuhan, that was quite a dramatic situation at the very beginning. But now the rest of the country certainly have long graduated from the fear of an epidemic. But for the United States, we saw, the death rate, the death number that has been very tragic. But now with vaccination rate up, what is likely to be the approach? Well, at the same time, learning the lessons of earlier times of not paying much attention or not having enough prevention and control measures.
The reality is that, a lot of the fear and anxiety we had, very early on in the pandemic, some folks still carry with and others don't, but maybe should have a little bit more concern. But look, economies are opening up and people are moving around now. Vaccine rates aren't where they probably should be to have this level of movement and activity. There's still a lot of susceptible populations, and we're seeing outbreaks in areas with low vaccination rates. I think we'll continue to see that. But at the same time, I don't think that there's much of an appetite for people to go back into restricted movement, whether the math works or not with regard to the epidemiology. So the reality here is that we have to keep pushing for vaccinations. We have to take targeted interventions where we can, but whether the United States or the rest of the world, people are tired of being locked up, and whether it's in their best interests or not, it's going to be very, very hard to re-implement movement restriction at this point.
Professor Fang, I'm sure you are aware of the upcoming Tokyo Olympic Games. Of course, right now, there is already quite a situation in Tokyo in terms of the rise of number of cases, confirmed ones. And the Olympic Committee, together with the organizing committee of the game, already decided that they are not going to have, in most cases, audience sitting in the stadium watching. But still, that is quite an event to watch. How do you see the signals, the result of the Tokyo game might send to the rest of the world? Professor?
I think Tokyo should be fine as long as there are no international audience from other country. Even though there are some local infections, particularly in Tokyo or in the area of Tokyo. However, I think the connections between the local people in Japan and the athletes from other countries are very limited. So in these
But what about athletes among themselves?
Definitely, that is possible. But before they come to Tokyo, they should be tested and also vaccinated. So they should be fairly safe.
Professor Wu, the Beijing Olympic Games upcoming in the winter time early next year. That is also a tricky one because not many people expected that the COVID-19 would last in such a severity for such a long time, and we see things are likely to continue for some time. So Professor Wu, as a health expert, how do you see this, and how is this providing you with another perspective watching the Tokyo game?
Well, actually, I think we are pretty confident right now because the overall new cases are very low. And
you mean in China?
Experience in China, yes, and our experience in responding to new infections surges are very effective, and it's unlikely that there is going to be a large surge of infections in China. So I think this kind of public health policies and the responding mechanisms should be effective in dealing with the COVID-19 in the upcoming Olympic Games in China.
When you say it should be sufficient, you are saying between the athletes or the delegation and the Chinese public, or among the delegation themselves, or?
Basically, I mean, it's in the audience, but dealing with the athletes actually is more complicated because you can't expect athletes to wear face masks and doing too much restraints on their activities. I think this is something actually we could, such as increase in the screening and monitoring of the COVID-19, things like that. I think, in the ways that we could prevent the infections.
We suffered over the past year, shall we put it that way, tremendously from COVID-19 worldwide. Then we learned a lesson somewhat, and also vaccines came into being with the support of science and also the scientists who are working around the clock. And now we seem to be in a better position, and yet there's Delta variant, and we don't know what's next. So to you, ladies and gentlemen, what are some of the factors you are going to watch very closely as we are deciding the approaches we're going to take as a whole in the world? Dr. Tulenko, shall I invite the expertise from the lady first?
Yes, the most important thing I will be watching is the emergence of new variants that might be more infectious and more deadly. I think that's the most important thing. Second most important is how quickly we can ramp up production of the vaccine. I don't think nearly enough effort has been put into it. And Europe has to release the patents on the Moderna and the Pfizer vaccines.
Professor Schlegelmilch, please.
Yeah, I mean, I think vaccination rates and where places are vaccinated and how those vaccines are holding up is really going to be a key determinant. The other piece that I'm really keeping a very close eye on is not just infection rates, but also death rates and hospitalization rates, because if we can get those down as low as possible, that's ultimately the end goal, is to keep people from getting very sick and dying from this. And that'll also come both from vaccinations as well as new treatments and better treatment methods around the world.
I see. Professor Wu Zhiwei.
Well, this virus apparently is highly resilient. It's new variants coming out very quickly, so this is going to become a new normal, and we have to live with that. So the vaccination, actually, as the previous two guests mentioned, that has to be improved, particularly in the low vaccinated nations. It's very important that we increase the vaccination in those populations. The other thing is that we need to increase the international collaboration to prevent the further pandemic.
Professor Fang.
I think the most important things for us is we have to cooperate together, and then we have to work together instead of criticisms. In other words, we have to build the community of health for mankind. And if we can work together, I think that will be possible for us to control and prevent COVID-19 in the near future.
We hope politics will not drag us down in this overall test of our ability this time. Thank you so much, all of you. Kate Tulenko, Jeff Schlegelmilch, Hai Fang, Wu Zhiwei. Really appreciate it.